If you can draw this diagram, you have a basic understanding of seizure classifications. Seizures are partial or generalized. Partial means only part of the brain is first affected. General means that more of the brain is affected. Partial can be divided into simple or complex. A simple partial seizure means that consciousness is not impaired, you're just twitching your hand. A complex partial seizure means consciousness is impaired, you're twitching your hand and you zone out. Generalized seizures also have categories. Absence seizures are like daydreaming, where someone is talking and then, "Oh, was I talking? I must have had an absence seizure." Tonic-clonic seizures have two parts. Tonic is the first part, when the muscle is tense. Clonic is the second part, when there are rapid convulsions. Status epilepticus means that epilepsy is not just a short event that's over quickly. It lasts so long it becomes the patient's status.
Hi, my name is Faith Cusimano. Today we will be hearing personal stories from individuals who have epilepsy and parents whose child suffers from it, and their point of views on the situation as a whole.
Another thing with epilepsy is everyone's triggers are completely different. Obviously the stereotype is strobe lights, but I'm completely fine. I can go out to clubs, I can just do regular things with strobe lights, and I will not be affected majorly by them. My triggers are not getting a good night's sleep, although that can vary. Not eating well. I need to have breakfast and lunch and dinner every single day, plus snacks in between. I need to drink lots of water, and I need to make sure that I just don't sit in the very dark room the entire day and just be a social hermit. I have to actually go outside. But yeah, so I saw the specialist in February of 2013, was diagnosed February 2nd, 2013.
Any age, causative factors are multifactorial. It can be because of genetics. Somebody in your family has seizures and it gets passed on to you. It can be because of a head injury, and we're seeing more and more of that, particularly with young people going to war and coming back with head injuries, motor vehicle accidents, athletic type concussion-related head injuries can all put a person at risk for epilepsy. Brain infections, meningitis, encephalitis, so on and so forth, or just sporadic. Somebody maybe has a little bit of a miswiring in their brain that puts them more at risk for having seizures, and of course lesions such as tumors.
She did not progress at all. She was not growing. She was not gaining weight. The doctors had given us a 0.1% chance that she would really do anything. They kind of felt like they had done everything they could do. There was no diagnosis, therefore there was no prognosis. We just felt like our hands were kind of tied.
You don't want to believe what they're telling you, and so you try and find alternative solutions.
I had a seizure at home. My mom took me there, and while I was in the waiting room to go into, a room, an emergency room, I had another one, and my mom was able to get them to make me a room there. They made a room out of a storage room for me because I was seizing out in the waiting room. So they did a really good job at taking care of me. I remember waking up from those 3 seizures in excruciating pain. I had the biggest migraine I've ever experienced, and I've had migraines since I was a kid. Also, it was just, my whole body was sore, and it was just a really bad time. I have a panic attack usually when I wake up from seizures. It's really hard to understand that your body is kind of betraying you, and it's hard to wrap your mind around the fact that your body can just do that. Because of my seizures, they decided to keep me in neurology ICU.
Our first encounter with Stacy's seizures was when she was about 7 months old. When I walked in the emergency room that day, Stacy was on a ventilator fighting for her life. Her first seizure lasted 45 minutes, and they had to give her so many drugs to get her to stop that they almost couldn't get it to stop. When she was about 1.5 years, 2 years old, she would take 20 pills a day. And all those medicines, none of them ever controlled her seizures. She's had so many side effects from these drugs. Some drugs made her so drowsy and drunk she would walk into walls, she would fall flat on her face. One of the hardest things I struggle with as her mom is I don't really know how this makes her feel. Some days I really wish she could talk and tell me, and then other days I don't, because I don't want to know how she feels. One minute she's perfectly fine, and the next minute we're rushing her to the emergency room. Sometimes her seizures last 5 minutes. Sometimes they last an hour and a half. The unpredictability is what's the hardest. Never knowing 1 minute what to expect the next minute. I worry most about the future for her. Trying not to think about it, but wondering when she's my age, can she have kids? Can she live in a house? Can she be on her own? That's probably what I worry about the most.
I just believe that if you get to optimal health, you won't have seizures. And I've found that to be the case in my experience. I suffered from seizures for 24 years, stayed on the medication for 24 years, and then decided, enough. Let's get as healthy as possible, come off the drugs, and see what happens. And I'm seizure-free without medication right now, and it's fantastic.